Hi, this is Dr. Darrell again. I want to give you some useful tips that you can use not only at home, but this is actually a tip here today that you can use to convey us information that benefits you more. So what we find useful is that the most useful info that you're going to provide to us. A lot of people are used to actually, when they're seeing a doctor or whatever, or they're using, it's like typically the medical insurance is like, is how do they feel? What is the pain level? That is not the most useful information to us because it doesn't tell us exactly how your body's functioning. So I'm going to show you a picture of a cross section of a nerve, and there's three main segments to the nerve. There's the autonomic, the motor, and the smallest bundle is the sensory. And even the pain within the sensory is even small itself. Of this whole cross section of the nerve, only about 10% of the nerves there are related to pain. So if you're just telling us how you feel, that negates or doesn't get information about a whole other 90% of the nervous system. So we're looking at, again, the whole nervous system working at its best. And when we do an adjustment, that's what we do. We take stress off the nerves so your body can work at its best. So I'm also interested in actually how other things are functioning. For example, this big blue section, this is all how all the muscles move and operate and contract. This section here is how actually there are parts of the nervous system that controls different organs, different glands. So if we have problems in this area, we often get sinus issues or low energy or digestive issues. If in the blue section, maybe muscles or spasms or fatigue or tightness. In here, this section where we get pain, but there's also other sensory issues like hot and cold, vibration, balance. Those are all important as well too. So when you come over to the table, we ask you anything new that we need to know about. What's useful telling us is how's your body functioning? Hey, things like, hey, I'm sleeping better at night. I notice I can walk a little further than what I could before. I'm not stumbling as much, or I have better balance. I feel like I'm standing straighter. I just felt like I just have more energy. All these things are very useful to us, and actually, commonly things that patients will tell us too is that I've had patients tell me that their blood pressure will lower, their immune system is stronger. They actually feel like they just have more energy and they're actually living life better. So these are all useful things to tell us. So make sure you share that information with us.